What is hypertension in Liddle syndrome? Have you ever wondered how genetics can play a role in high blood pressure? Today, we are discussing hypertension in Liddle syndrome, a unique condition that affects blood pressure regulation. This form of hypertension is not your typical high blood pressure. It is caused by a genetic mutation that leads to increased sodium reabsorption in the kidneys. This happens specifically in the distal nephrons collecting tubule, where the body absorbs too much sodium and water. The mutation affects the epithelial sodium channels, making them overly active. This overactivity causes the body to retain more sodium and water, which increases blood volume and raises blood pressure. Interestingly, this condition occurs even when levels of aldosterone, a hormone that usually helps regulate sodium balance, are low. The mutated channels work independently of aldosterone signaling, which is quite unusual. People with Liddle syndrome often experience hypertension along with low potassium levels, a condition known as hypokalemia. They may also develop metabolic alkalosis, which means their blood has a higher pH due to bicarbonate retention. This syndrome typically presents early in life, often before the age of 35, and is inherited in an autosomal dominant manner. This means that just one mutated gene from a parent can lead to the disorder. Treating hypertension in Liddle syndrome can be challenging. The high blood pressure is resistant to standard treatments that target aldosterone pathways. Instead, treatment focuses on blocking the overactive sodium channels directly. Potassium-sparing diuretics, such as amiloride or triamterene, are often used. These medications help reduce sodium reabsorption, which can normalize blood pressure and balance electrolytes. Dietary sodium restriction is also essential. Limiting sodium intake helps control hypertension by reducing the amount of sodium available for reabsorption. From the perspective of hypertension and kidney disease, Liddle syndrome illustrates how genetic changes in kidney function can lead to persistent high blood pressure. The kidneys play a vital role in regulating blood volume and pressure. When sodium retention increases due to the mutation, it expands extracellular fluid volume, raising blood pressure. If left untreated, this form of hypertension can damage the kidneys and the cardiovascular system. In summary, hypertension in Liddle syndrome is a genetically driven condition that leads to high blood pressure due to increased activity of sodium channels in the kidneys. This results in sodium and water retention, low potassium levels, and metabolic alkalosis. The treatment approach focuses on targeting these channels directly rather than the usual hormonal pathways. Understanding this condition is essential for managing hypertension effectively and preventing complications.